Module 4 will cover cancer patients and organ transplant patients. We touched on organ transplant patients in Module 3, and we're going to continue some more investigation about these patients in this lesson. Cancer patients are exposed to what we call a neoplastic disease. This malignant process it can involve as many as 100 different types of cancers. 40 to 80% are treated, will experience some type of oral complications, which makes cancer patients and their treatment very important to dental hygiene. Adverse effects from existing oral and dental pathology do play a role with cancer patients as well, and can lead to serious conditions as advanced periodontal disease and more bleeding, a lot of different complications that as thrusts which affect their health and their diet. Head and neck cancer treatments also may result in complications that will affect how the quality of a patient's life. Oral hygiene prevention may prevent or improve their condition, which gives us the advantage of advising these patients in these situations. Typically, they're known to have bleeding sores, lumps, thickenings. You'll notice white and red patches throughout the oral cavity that does not want to heal. Typical treatments involve chemotherapy, radiation, surgery, hormone therapy, sometimes bone and marrow transplants, or a combination of either of the above. Let it be known that cancer is the second leading cause of death in adults under the age of 85. So factors of survival are very important. This little chart will bring up the different incidences and prevalence of 10 different types of cancer. Back in 2009, this was taken. Breast cancer being the #1 cause of death, and prostate being the least. So you can take a moment to study this and see that even males, it's not registered on here. They show a 1. That means there was 1 incident of breast cancer among males that led to death in this particular chart. But as the scale moves down, lung cancer, cervical cancer, colon, stomach, ovarian, endometrium cancer, and ending with prostate cancer. There is no one cause of cancer. There are many, many risk factors. The most common causes that we can associate with cancer or the promotion of cancer is tobacco and alcohol use, ultraviolet rays and sunlight, and radiation exposure. Also, high levels of estrogen and other hormones promote cancer. Occupational and environmental hazards, that's exposure to radon, asbestos, lead, oil, and refineries, all are known risk factors. Viruses such as the human papillomavirus and the Epstein-Barr virus are also known to cause cancer. Certain ethnicities, as African Americans, are known to be more prone than other races. Social, economic, and educational factors as low income can contribute to cancer due to a lack of good nutrition and healthy living conditions. And also the diet that consists of low fiber and high fat content will known to be more promote more risk for cancer as well to develop. There are 5 varying stages of cancer. The following is the most commonly used descriptions. Stage 0 is the very beginning of cancer with only a few cells present. This is in their early form and called in situ. Stage 1 identifies a relatively small and contained cancer, and this is a conglomeration of possibly just cells within a particular organ. This is very localized. Stage 2 describes the spread of cancer to the surrounding tissues, not larger than stage 1, and its early locally advanced cancers. Stage 3 identifies the spread of cancer to surrounding tissues and cells within the lymph node system. Late locally advanced is also a name for stage 3. And stage 4, which we know as metastasized cancer, is the last of the stages describing the spread of cancer to another body organ. Within the dental hygienist scope of practice, they must be acutely aware of the appropriate recommendations for a cancer patient. An initial consult with a physician for antibiotic therapy for platelet support must be addressed prior to dental procedures. Home care recommendations include a super soft toothbrush and fluoride paste. Patients must be advised to avoid soft foods that will irritate the oral cavity and rinse their mouths often. The use of artificial saliva substitutes may be recommended as needed, and the use of daily professional fluoride treatments should be suggested in the case that rampant decay becomes prevalent. Recommendations is rinsing with baking soda in a mixture of 1/4 teaspoon to 1 cup of warm water following vomiting may help with perimyellosis. Saline rinses to soothe gingival tissue are mixed at a 1/2 teaspoon to 1 cup of warm water for ulcers, trauma, and infections. Chlorhexidine rinses are recommended to reduce inflammation. Hydrogen peroxide and water may be recommended in a 1:4 ratio. If the patient prefers any of these solutions, they can be applied with a gauze. It is highly recommended that all alcohol-containing mouth rinses be strongly avoided. Oral care is often neglected due to the medical issues associated with cancer treatment, and the onset of depression and stress always bring on more problems. Oral complications arise and include xerostomia or thickened saliva, damage to salivary glands, medication-induced oral lesions, or changes in the oral cavity such as taste dysfunction, the inability to practice good oral hygiene, candidus, herpetic infections, rampant decay, and radiation caries. Also, the demineralization of tooth structure known as osteoradionecrosis does develop. Other conditions as oral bleeding due to thinning mucosa and the inability to chew and excessive vomiting all play roles in having oral complications and maintaining good oral health due to cancer treatment. Nutritional reassessment should be performed at each appointment to improve conditions associated with chemotherapy or radiation. Nutritional counseling should address the malnutrition that occurs due to vomiting or lack of eating from depression, stress, or unwillingness to live. Recommending a balanced low-sugar diet for the prevention of infections and to promote healing is utmost important. And encouraging the consumption of anti-cancer superfoods as garlic, oily fish, almonds, lemons, berries, beans, and vegetables is very important. Advise the patient to avoid any type of spicy, hot temperature, or acidic foods. Diets that aid to limit the vomiting and nausea are bland, high in caloric. Liquids include carbonated drinks, and small, timely meals and snacks. The classification of cancer is based on origin of tissue and cells involved. Two types exist, epithelial and connective tissue. Cancer can be found in any organ or tissue and can metastasize. The first place is usually found in the lymph nodes, the liver, the lungs, or the bone. The pattern of spread suggests the location of origin, and the type of cells provide clues to the hidden primary sites. Most primary sites are lung and pancreas, followed by breast, prostate, colon, and rectal. Take a moment to study this pie chart on the different types of cancer and the percentages they make up in a whole of all the cancers that are diagnosed. There is no easy screening for bladder cancer, and experts urge people to pay attention to the signs of bladder cancer, which develop in some 23,000 Americans each year. Bladder cancer accounts for 5% of all cancers. Increased risk of bladder cancer includes smoking, textile industries, and spinal cords. The most common symptom is hematuria, which is blood in the urine, and painful frequent urination. Let's take a moment to watch this video on bladder cancers.
Bladder cancer can cause the death of around 13,000 people in America every year. Dr. Cheryl Lee urges people to pay attention to possible signs of the disease.
Bladder cancer is not as common as some cancers that many may hear about, including prostate cancer and breast cancer. We know that older patients tend to develop bladder cancer. The average age is in the range of 65, so that it's much more common in older populations. those who smoke are at great risk. So we always want to caution people about smoking, and we recommend smoking cessation programs. Those who have been exposed to chemical agents, particularly at work, industrial solvents, paints, paint thinners, those types of things increase the risk of bladder cancer development, particularly if someone is a smoker. For many patients, there may be no symptoms. When the disease does present, the most common symptom is going to be blood in the urine. Occasionally, it may cause some symptoms in the way a patient may urinate. Frequency of urination, urgency of urination, sometimes pain on urination, or difficulty urinating. As the disease progresses, we may find that there are additional symptoms. Abdominal pain, which is pain in the midsection, pain in the bones. Those types of symptoms are really a reflection of very advanced disease, though. The success of treatments of bladder cancer are highly dependent on what stage the bladder cancer is in. The stage essentially refers to the extent of tumor or cancer, so that tumors that are picked up in the early stage, in other words, those who are just on those tumors that are on the surface of the bladder and not invading the wall of the bladder, those early tumors are highly curable. So catching them early is important. If someone is concerned that they may have symptoms suggestive of bladder cancer, they should see a urologist. A urologist will then do a series of tests in the clinic to help prove that or disprove that. It's very important for patients to pay attention to the symptoms that they may experience. For example, if someone has blood in the urine, they may have the tendency to dismiss that or ignore that. I can't emphasize enough that it is very important for patients with that symptom to be evaluated by a physician. Blood in the urine is never normal, and that should always be evaluated.
Bone cancer constitute 1% of all cancers, with approximately 2,000 people afflicted yearly. Bone cancer can begin in any bone in the body, but most often it is found in the arms and legs of 10 to 25-year-olds. Several types of bone cancer exist. Some types of bone cancer occur primarily in children, while others affect mostly adults. Osteosarcoma is the most common of 10 to 19-year-olds, and chondrosarcoma in 40-year-olds and older. Symptoms include unusual pain and swelling near the affected area, bone fractures, lumps, unintended weight loss, and fatigue. It is not clear what causes most bone cancers. Doctors know bone cancer begins as an error in a cell's DNA. The error tells the cell to grow and divide in an uncontrolled way. The cell goes on living rather than dying at a set time. The accumulating mutated cells form a tumor that can invade nearby structures and spread to other areas of the body. Risk factors include inherited genetic syndromes. Certain rare genetic syndromes passed through families increase the risk of bone cancer, including the Lee-pheromones hormone and the hereditary retinoblastoma, or other diseases as Paget's disease. This precancerous condition that affects older adults increases the risk of bone cancer later in life. Also, radiation therapy for cancer does lead to bone cancer later on. Exposure to large doses of radiation, such as those given during radiation therapy for cancer, increases the risk of bone cancer in the future. Blood cancers affect the production and function of your blood cells. Most of these cancers start in bone marrow where blood is produced. Stem cells in bone marrow mature and develop into 3 types of blood cells: red, white, and platelets. In most blood cancers, the normal blood cell development process is interrupted by uncontrolled growth of an abnormal type of blood cell. These abnormal blood cells or cancerous cells prevent your body from performing any of its functions, like fighting off infection or preventing serious bleeding. There are 3 main types of blood cancer: leukemias, lymphomas, and myelinomas. Leukemia is a type of cancer found in your blood and bone marrow. It causes a rapid production of abnormal white blood cells. The high number of abnormal white blood cells are not able to fight the infections, and the impairment of the ability for the bone marrow to produce red blood cells and platelets. Lymphoma is a type of blood cancer that affects the lymphatic system, which removes excess fluids from the body and produces immune cells. Lymphocytes are the type of white blood cells that fight infection. Abnormal lymphocytes become lymphoma cells, which multiply and collect in your lymphatic nodes, system, and lymph nodes and other tissues. Over time, these cancerous cells impair your immune system. Melanoma is a type of blood cancer that specifically targets your plasma cells. Plasma cells are white blood cells that produce disease and infection-fighting antibodies in your body. Melanoma cells prevent the normal production of antibodies, leaving your body's immune system weakened and susceptible to infection. Many complications are associated with treatments. Risk factors associated with these cancers include congenital disorders, exposure to toxic chemicals, radiation, and previous bone marrow disorders. Breast cancer is the most common form of cancer in women. Over 200,000 new cases are detected yearly, and over 40,000 deaths occur annually. Cancer in men is rare, but does occur. Breast cancer is most commonly found in ducts and lobules. Less commonly found in supporting tissues to include fibrous connective tissue, blood vessels, and lymphatic system. Therapy involves the administration of hormonal therapy for metastasizing estrogen receptors, inhibitors used to attack estrogen production, surgery, chemotherapy, radiation therapy, immunotherapy, and vaccine therapy. Let's take a moment to view this short video on the symptoms and treatment of breast cancer.
Cancer is the result of mutation of the genes responsible for the growth and health of the cells in the body. This abnormal proliferation may occur to the breast cells, which is called breast cancer. Breast cancer cells may continue dividing without a halt, resulting in a tumor. Breast cancer is common to women, but men are also susceptible to breast cancer. People suffering from breast cancer may not show symptoms at all, especially in its early stages. But a new lump or mass in the breast can be indicative of breast cancer. Generally, any change to the breast appearance, texture, and pain can be a sign of breast cancer. Nipple discharge or redness, breast or nipple pain, dimpling, or swelling of the breast can also be signs of breast cancer. Breast cancer has better prognosis once treated in its early stages. Thus, women are advised to undergo routine screening procedures to detect breast cancer earlier. Monthly breast self-examination, clinical breast examination, and mammography are the recommended routine screening procedures to detect breast cancer, even without obvious symptoms. Breast cancer development can be associated with a family history of breast cancer, early onset of menstruation, late menopause, dense breast tissue, exposure to carcinogens, the use of oral contraceptives, or drinking excessive alcohol. Breast cancer has various types. Some types are ductal carcinoma, lobular carcinoma, mucinous carcinoma, mixed tumors, and inflammatory breast cancer. Treatment of breast cancer is dependent on the type of cancer and its stage. Basic treatment options available to breast cancer patients are surgery, which involves the removal of the cancerous tissues, radiation therapy, that aims to destroy cancer cells by the use of high-energy rays, and chemotherapy, which treats breast cancer with medications. Consult your general practitioner whenever you notice any changes in your breast. He or she can examine you and refer you to a specialist if necessary.
Lung cancer is one of the most common forms of cancer diagnosed in the U.S. Approximately 1,072 new cases are diagnosed annually. Symptoms involve coughing up blood, chest pains, and shortness of breath. Risk factors can be hereditary, personal and family history, genetic alterations, age, environmental carcinogens. Women tend to be more susceptible than men, and tobacco smoke contributes to 8 out of 10 cases of lung cancer. Other contributing factors is radon, air pollution, cancer-causing agents in the workplace, tuberculosis, certain types of pneumonia, and someone's diet. Pancreatic cancer is one of the most difficult types of cancer to detect. It is very aggressive, and typically 30,000 new cases develop yearly. It is the 4th leading cause of cancer-related deaths in the U.S. Pancreas is located in the abdomen behind the lower part of the stomach, and it aids in digestion. It contains both exocrine glands and endocrine glands. Risk factors involve smoking, typically people between the ages of 60 and 80, African Americans, men more so than women, diabetics or those with chronic pancreatitis, those who suffer from peptic ulcers, diet and alcohol contributing to the disease. Symptoms involve abdominal pain, bloating, weight loss, loss of appetite, diarrhea, and jaundice. Head and neck cancers claim usually 60,000 cases a year. Oral cavity, nasal passages, paranasal sinuses, orbits, larynx, pharynx, and salivary gland tumors are all involved in head and neck cancers. Most common is a squamous cell and its unknown cause. Risk factors include tobacco and a history of precancerous lesions and exposure to cancer-causing agents in the environment. Symptoms involve swelling, lumps in the head, neck, or throat, reddish or grayish patches in the mouth, frequent bleeding through the nose, ongoing nasal congestion or sinus infections, persistent sore throat, hoarseness or change in voice, pain in the neck, throat, or ear, blood-tinged sputum, chewing made difficult, swallowing or moving of the jaw or tongue, numbness in the tongue or other areas, and loosening of teeth or dentures that no longer fit. Oral cancer consumes 35,000 diagnoses yearly and causes approximately 7,500 deaths. 60% survival rate does occur within 5 years. Early detection and timely treatment can reduce these deaths. 5-year survival rates for those with localized diagnosis is 82% compared to 28% of those cancers that have spread. Men are more likely than women to have oral cancer. 1.5 times more higher in African Americans than other races. And 90% of these cancers are squamous cell. Risk factors include tobacco, alcohol, sun, and history. Symptoms involve white, red, or a mixture of red and white patches inside the mouth. White patches, also known as leukoplakia, are most common. The mixture of red and white patches, uroleukoplakia, are more likely than white patches to become malignant. And red patches, erythroplakia, are bright-colored, smooth areas that often do become malignant. Sores on the lips and mouth that won't heal, bleeding, loose teeth, difficulty wearing dentures, difficulty or pain with swallowing, lumps in the neck or oral cavity, and earaches are all common symptoms of oral cancers. This is a very sad story. It's called Andy's story. I'm only introducing this video to you because this is a young person that you would never think that would die of oral cancer. Take a moment, sit back, and let's watch this video.
Hi, I'm Thomas. Aaron and I would like to share a story about a friend named Andrew Semesco who died from oral cancer when he was 21 years old.
Our goal with this video is not to lecture you, but to educate you about oral, head, and neck cancer.
On September 29, 1977, Andrew Semesco was born. When Andy was young, he came to know a group of people that ended up being his best friends for life. In high school, Andy was an active student, an athlete, and he graduated with honors. Andy then attended Florida State University.
When Andy was 20 years old and entering his 3rd year of college, he was leading a pretty normal life. He was an officer in his fraternity and enjoyed spending time with his friends and family.
He was in college, and 3rd year of college, and in a fraternity, going to school, had a girlfriend, just, you know, the usual 20-year-old activities, having a great time. Life was wonderful. Loved his fraternity and his fraternity brothers.
Then, on October 29, 1998, Andy was diagnosed with a form of oral cancer at the base of his tongue.
I remember when we heard what was going on, nobody really knew exactly what to make of it, because you hear about cancer, but you don't really know what it is. You don't really know how it works. You don't even really know how it harms people. You just know cancer is bad, and eventually, it kills people.
Andy was one of those special people. You immediately liked Andy. And when I first saw Andy and heard that he had a problem, I found it hard to believe, because he was young and he was strong and he was healthy and he was a student, and it was just one of those things where I didn't want to believe that he had a cancer.
What is oral cancer? Oral cancer is found in the mouth, on the lip, and in the throat. Both the oral cavity and throat are made up of several different types of tissue. Many different kinds of cancer can form in these areas. Andy's cancer began on the bottom of his tongue.
Oral cancer really has 5 different appearances, and it's very tricky, because they often start out as looking very innocent. They can look like little white fluffy areas on your gum or on your tongue. And other times they look like little flat white spots or red spots, or they can be even mixed, red and white. When they get older and they've been there longer and they've grown for a while, then they start getting to be really large growths that they can grow out into the mouth and look like a head of cauliflower. They actually look like a white fluffy, white thickened area. And then other times they'll grow into the tissue and they'll feel like a rock hard, ulcerated mass, like a sore, and they don't hurt. And that's one of the things that's really bad, is that patients, since things don't hurt, oftentimes they don't present until they've already had the cancer spread throughout their body.
Following are signs and symptoms frequently associated with oral cancer: a sore in the mouth that does not heal, the presence of a lump or a thickening in the cheek or neck, the prolonged presence of a white or red patch in the oral cavity, prolonged sore throat, numbness or swelling in the mouth, drastic weight changes. Any of these symptoms could signal the presence of cancer. Therefore, it's important to seek the professional opinion of your dentist or doctor if you're concerned.
Andy didn't do the usual things that would put him at high risk for cancer, and we can't prevent the unusual from happening like it did to Andy. But through our friend's battle with this disease, we've learned that certain activities can increase your chances of getting oral cancer. Smoking, dipping, and chewing tobacco greatly increase one's risk for developing lip, gum, and cheek tumors by as much as 50 times.
According to the American Cancer Society, 90% of people with oral cancers are tobacco users. Smokers are 6 times more likely to develop tumors of the head and neck than are non-smokers. Pipe smokers are more prone to lip cancers, and cigar smokers are at higher risk for tongue and other oral cancers. The nicotine in these products is highly addictive, so quitting may be difficult.
What happens when you smoke is that there are cancer-causing compounds in the smoke, and they're called carcinogens, or chemicals that cause cancer. And what they do is they actually damage the cells. And in the cells you have genetic material which is on a chromosome. And these chromosomal changes are called mutations. Now, typically, when you get mutations in critical areas, that's what causes cancer.
You think that cancer in general, and specifically oral cancer, affects older people only. However, research in the area shows that younger people are often influenced as well. Prolonged use of tobacco products like cigarettes and snuff is not required for someone to get oral cancer. As a friend of Andy, I know this disease can affect young people. I would like to encourage you to check your mouth routinely and ask your dentist for an oral cancer screening at your next visit.
While there are no guarantees, we do know that these behaviors over time can increase the chances of developing an oral cancer. So why take the chance? For you, it all comes down to making wise choices.
Patients who are treated for oral cancer go through quite a bit of suffering. There are 3 main ways in which oral cancer can be treated: surgery, radiation, and chemotherapy. Each of these have terrible side effects. Surgery involves removing a piece of or the entire tumor. Sometimes people will lose a large part of their tongue or jaw, which affects eating and speaking.
And I've seen patients who have had, that I've operated on, that I've had to take out part of their tongue, and they'll talk like this, and that's the way they talk the rest of their life. And it's very difficult for people to understand them.
Radiation treatment is used to stop cancer cells from growing. Radiation is aimed like an X-ray at the tumor. Unfortunately, the radiation also kills the normal cells around the tumor. Radiation treatment kills the salivary glands, leading to a very dry mouth, and it can also cause people to lose their teeth.
So after you get radiation, it does affect the salivary glands or the spit glands, and so these people are walking around and their mouth is so dry that they often have a bottle of water in their hand and they're constantly drinking water. It also ruins their taste, so that the things that they used to love to taste and the things that you love to taste and eat, you can't enjoy that anymore.
Chemotherapy means treatment with chemicals. These chemicals affect every part of the body, even though the cancer is only in the head and neck. It leads to people losing their hair and becoming very sick to their stomach.
And you've all seen somebody who's gotten chemotherapy. They lose their hair, they get sores in their mouth, they get really sick to their stomach, they can't eat.
Unfortunately, oral cancer survival rates remain low.
Half of the patients that I have treated with any of those kind of treatments or any combination of them, half of them have died. If you yourself start smoking, please do everything in your power to just stop, so that you don't end up being one of my patients or being one of those two who will die if you get that cancer.
Andy did not have surgery for his tumor, but was treated for several months with radiation and chemotherapy. He experienced several of the side effects we have mentioned. He lost his hair, lost his salivary glands, and sense of taste, and he was very sick to his stomach.
So what can you do to prevent oral cancer? The biggest things you can do are not smoking and not using smokeless tobacco. Also, you can ask your dentist for an oral cancer screening during your regular dental checkups.
The key is that you need to go for regular dental checkups and not wait for something to hurt or something to be really massive before we start to treat it.
Andy battled his cancer for 5 courageous months before it overcame him. On April 1st, 1999, after being in the hospital only 4 days, Andy Semesco passed away. Andy was 21 years old. He left this earth with all of his friends and family by his side.
And we're all sitting around the bed, and he just looked up at every single one of us and gave us a smile, shook our hands. You know, we all gave him hugs because we knew that this might be the last time we'd ever see him again. And it was then I leaned over and I made him a promise that I would do everything I could to make sure that what happened to him didn't happen to other people.
What I miss about Andy is his positive attitude and his love for life. And even when he was very sick with his chemo and x-ray therapy for his cancer, he said,
It's kind of ironic to say good things can come from bad things, but I truly believe it. I began to realize the type of friends I had and how wonderful and caring they are, and how precious life is, and not to take things for granted. It has really changed the way I approach life and other people with problems of their own.
and if this video will help a young person from getting cancer, then something good has come from this.
Andy's story touches all of us. It's his memory we preserve forever. Andy left us at a young age, and it's our goal to help educate teenagers and young adults to make good health choices.
Just remember, what you do today can have a big impact on your health in the future. From all of us here at the Andrew J. Semesco Foundation, thanks for watching.
I realize these pictures are quite gruesome, but this is life-threatening oral cancer. And when you take a look at the lesion that this patient started with when it was finally diagnosed, and the evolution of the treatment and surgery that he entailed to go through to survive, It is very involved. Just wanted to let you see that this is the end result of when you have patients that continue to dip or smoke, and how important it is to perform oral cancer exams on everybody. There is a wide variety of cancer treatments, from chemotherapy to radiation to surgery to transplants. So as you write your case studies, keep in mind that if you select a cancer, which you will, to explore some of the different type of therapies that are out there. You just never know when your knowledge of this treatment is going to help you one day with some of your patients. Chemotherapy is an anti-neoplastic drug that attacks rapidly dividing cancer cells, used as a single agent or in combination with other treatments. Systemic side effects can be mild to life-threatening, and the objective is to control the widely scattered neoplasms, to supplement surgery or radiation, and to provide palliative care for patients with advanced sarcoma, squamous cell sarcomas of the head and neck. Immunosuppressant drugs place patients at risk for infection. These infections also have side effects as nausea and vomiting, hair loss, GI disorder, and diarrhea, xerostomia, or mucositis. Ionizing radiation used with surgery or isolated treatment can be done pre-op or post-op. Contraindications and results can lead to osteonecrosis of the jaw, which occurs from radiation damaging bone cells and blood vessels, changes in the endothelial cells that leads to sclerosis of these vessels, causes changes in the bone growth, and lowers the resistance to infection. There are several dental hygiene assessments that are performed. We always evaluate the risk factors to determine the use of alcohol, exposure to sunlight, or poor oral hygiene. Pre-treatment assessment is a typical routine we do to evaluate the head and neck or oral facial soft tissue, hard tissue, consistency of saliva, any previous history of oral complications having to do with cancer treatment, and if any cultures are being performed throughout treatment. Preparation for treatment is very important because we need to know the level or the ability to schedule our appointments and what it takes for us to actually reduce the oral microbial count, so that way the patient has excellent healing. We want to provide the very best environment for any type of therapeutic treatment, and improving their healing is going to be of utmost importance, especially if the patient is undergoing radiation or chemotherapy. Post-treatment evaluation involves recall selection and evaluating the head and neck and any intraoral tissue for periodontal health. And if we need to proceed with SRPs, we examine the patient and chart any type of dental caries and assess salivary flow to see if there's been any change. Nutritional counseling becomes a very important aspect of our appointment, as we do know that radiation therapy and chemotherapy both affect a patient's nutritional and dietary needs. We want to manage any additional effects that may develop, and we want to make sure to document any referrals that we feel is necessary at this time. In scheduling any type of appointment, we want to make sure that we consult with the oncologist to determine if pre-medication is necessary and that the platelet level is at the appropriate level to perform treatment. We want to evaluate the oral care appointment to see if Prophy plus sealants is necessary and if the addition of home fluorides or any other type of fluoride treatment is recommended. Restorative treatment must be determined to see if the patient can tolerate this type of any longevity to an appointment, and to see if there's any adjustment or any new fabrications to the prosthesis, if we need to restore any carious lesions, if any extractions need to be done, any type of endodontic work, or any type of occlusal adjustment. One of the main things we want to consider when we evaluate our patients is any complications that has evolved from the manifestation of cancer treatment. First 2 weeks following the early stages, we have mucositis, erythema, edema, any type of reduction in salivary flow or dysplasia. Now, these symptoms may not evolve they may have already subsided by the time we see these patients, because most likely in these conditions you wouldn't be doing treatment. The later stages is the ones we tend to be more concerned about: the xerostomia, the ulcerations, any type of oral lichen planus, stomatitis, radiation caries, osteoradionecrosis, any type of trismus. All of these are going to affect your appointment and any recommendations for treatment. Other considerations are to reevaluate periodontal disease at every appointment, and if the dentures have become ill-fitting, any retained roots that may have developed through radiation caries is another consideration for treatment, and also scheduling them at the appropriate time. This chart I created to help you with any of the complications that develop and any particular direct risk factors, as well as indirect risk factors. Reference this later as you do your case study. Two main side effects of cancer treatment is salivary gland disorders and dysplasia. These symptoms typically develop within a few days following treatment and may take up to 2 to 4 months before they regain any type of function. As far as salivary disorder, sometimes this reduction in salivary flow, depending on where the cancer is and the head and neck radiation that the patient received, this may not return to normal. There are many suggestions we can make to our patients to help them be comfortable when they've lost salivary function. Please make note of some of these suggestions and add them to your case studies. Salivary substitutes, water, ice chips. Prilocaine therapy may also help. That will help ease any of the discomfort with chewing from any tenderness that they develop. And over-the-counter and prescription products as Biotin, Oasis, PerioWash, and Oragel are all recommended products for these patients. Radiation and chemotherapy both bring about dry mouth that leads to the inability of the saliva to destroy bacteria. And then we see the incidences of caries that is prevalent with a lot of our cancer patients. Treatment for this condition may be not solved just by fluoride application, saliva substitutes, and changes in oral health products. This slide introduces the treatment recommendations for over-the-counter medications to help patients that are dealing with cancer treatment and oral effects. Please reference this as you perform or create your case studies. It is very important to note that the patient's diet has to be discussed, and evaluating their disease condition for any new situations as ulcerative mucositis, any bacterial, viral, fungal infections, and any transient xerostoma, jaw pain. In children, we have to deal with root development, delayed eruption, gingival bleeding, and petechiae, any type of neurotoxicity. Secondary oral infections become a primary focus for dental hygiene. We want to make sure the patient is comfortable, so we are always consistently evaluating the mucus and evaluating the periodontal disease, looking for any new lesions, and then if there has been any type of extraction to monitor the healing. There is always signs of pain that the patient experiences and difficulty opening their mouth. Sometimes they develop halitosis. The management of these conditions can be oxygen treatments, antibiotic therapy, and just home care regimens. And one thing we do need to be aware of, that once they develop any type of oral infection, it can lead to other infections. So we want to evaluate the bacterial, viral, and fungal conditions in their mouth. Mucositis is the #1 common oral condition that develops following cancer treatments. It usually develops within a week and lasts about 2 weeks. Typically, you will not see the patient during this time, but what you will see is the after effects of these breakouts and this infection. The patient is usually prescribed saline or sodium bicarbonate solutions, as well as topical anesthetics and analgesics. The one thing that I do like to point out is if the patient does develop continuous and xerostomia, you want to keep them on a baking soda solution to keep the pH of the mouth reduced, which will help not only with the oral mucositis, but also with caries that will develop later. Take a moment to review this slide as it gives you the prevention of an oral care protocol for mucositis. Typically, we have patients that will use a cryotherapy for about 30 minutes, soft bristle brushes, avoid any type of hot, spicy foods or anything that would abrade the tissue, any commercial alcohol, mouthwashes, and you're going to be limiting dental floss during this time until their platelet level is back to normal. In creating your case studies, you will be selecting medications. If any of the medications for cancer or the chemotherapy that you choose is on this list, you may want to note in your charting that the patient may develop mucositis. Within the herpes family, there are 25 herpetic viruses, 8 of which are linked to oral infections that are associated with chemotherapy and radiation therapy. 1 through 8 are listed, and we'll go through them carefully and show images of their effects on the oral cavity.
The following videos will relate to oral diseases associated with viral infections. Take a moment to view the images of each viral infection prior to the start of the videos.
Hi everybody, this is Kaylee, and today we're going to continue our discussion on sexually transmitted disease by talking about genital herpes. So, first and foremost, what is genital herpes and how common is it really? Well, genital herpes is a viral sexually transmitted disease that takes 2 forms, type 1 HSV1 and type 2 HSV2. Now, the more common one is HSV2 in most genital herpes cases. Right now, in the United States, 45 million people have reported to the CDC that they have genital herpes. That means 1 out of every 5 adolescents and adults have the disease, which also means it's Russian roulette down at the frat house. Genital herpes type 2, HSV2, remember, is more common in women than it is in men. Typically, 1 out of every 4 women with herpes has type 2, as opposed to 1 out of every 8 men. Overall, however, over the past decade, numbers of genital herpes cases have been decreasing in the United States. So, if 75% of the adult population actually carries the herpes virus, well, how do you know? How do you have any idea if you're infected with genital herpes? The signs and symptoms may or may not occur. Most people with type 2 genital herpes have no idea that they're infected. However, if symptoms are going to occur, they'll usually show up about 2 weeks after the virus has been transmitted. And they'll show up as painful blisters around the genitals or rectum. Unfortunately, these blisters will burst, leaving tender ulcers that take anywhere from 2 weeks to a month to heal. The first appearance of these sores in people with genital herpes is generally referred to as the first outbreak. Now, when this happens, some other things can also occur, such as a secondary cluster of sores appearing immediately after the first has healed, and also flu-like symptoms, including fever and swollen glands. Now, unfortunately, most people with type 2 genital herpes have no idea because they never have sores that show up. And if they do, it's so mild, it's often mistaken for another skin condition such as a rash caused by your genes or sometimes even a bug bite. Now, typically, if this first episode or outbreak has occurred and been diagnosed properly, those with type 2 genital herpes can expect to have 4 to 5 more outbreaks over the course of the first year. Typically, these will decrease with time. However, if you have type 2 genital herpes and are unaware, years can go by without the occurrence of a first outbreak. So, if you have herpes, whether or not you're aware of the signs and symptoms, or if you show them, they can cause complications. Now, in adults who have suppressed immune systems to begin with, infection can be severe, causing painful genital sores in most adults and adolescents. We've already discussed this. However, for the most part, herpes causes more psychological distress than actual physiological distress in the infected. This has one exception though. With pregnant women who have been diagnosed with herpes, they can pass this on to their newborn children during vaginal birth, and this can lead to serious life-threatening infections in their babies. Now, for the most part, if herpes has been previously diagnosed, a cesarean section will be performed to deliver the baby so that these complications can be avoided. Now that we've talked about your risk of getting genital herpes and what can happen once becoming infected, let's find out. Is there any treatment for herpes? Well, yes, there is treatment for genital herpes. There are certain antiviral medications out there that can help prevent or shorten outbreaks in some cases. However, being a viral sexually transmitted disease, at this time there is currently no cure for genital herpes. So once you have it, you're stuck with it for life.
Oral viral treatment is divided into 2 categories. One is to reduce the symptoms by making the patient comfortable and offering over-the-counter products. The other one is specific to antiviral therapies that hasten healing. Below is the list of a few of the medications that are used. Oral fungal infections are also common, with the overgrowth of C. albicans due to the treatment that is given with chemotherapy and radiation. Protocol is topical oral antifungal agents for the patient. This is another common condition that we see with our cancer patients. The protocol for children is really no different than adults, other than the fact that we are watching their eruption patterns and tooth formation a little closely. We want to inform their caregivers as well as the patients on how to perform proper oral hygiene and to avoid any type of carcinogen foods or beverages. Our last topic will be organ transplant patients. As mentioned in the lecture in Module 3, we'll go into a little bit more detail and show some visuals. In 2013, there are 29 solid organ transplants performed, 6,300 stem cell transplants. Treatment for life-threatening leukemia, lymphoma, and other diseases are included in these statistics. Developing cancers from extensive use of immunosuppressant drugs is on the rise, as squamous cell carcinoma of the tongue, salivary gland, lip, and throat are very common, as well as oral Kaposi sarcoma and lymphoma. Compromised immune places patients at risk for oral care. We must time the appointments, determine the need for antibiotic therapies. Initial exams and oral exams may be done with or without probing or radiographs. Precautions for excessive bleeding is very important, and also for following oral infections that develop. Oral cancer exams are the most important thing we can do in a patient with an organ transplant. There are 4 common organ transplant immunosuppressant drugs. I am not even going to begin to pronounce them, but you can see from the images they typically have a very common appearance in the oral cavity. Gingival hyperplasia among children is very common. Bleeding, poor wound healing. Some of these drugs even promote hypertension and numbness or tingling in the oral tissue. Other related complications involve stomatitis, decrease in white blood cells, excessive bleeding. So gastrointestinal problems, there is an array of problems that develop just because of these organ transplant drugs. Some immunosuppressant drugs bring on hypertension and high blood glucose. They also change the mood of the patient and bring about oral lesions around the cheek and the tongue and around the lips. Adrenal suppressive drugs make invasive dental surgery or treatment very difficult. Other situations with these patients develop oral ulcers and joint pain. One of the most important things for patients to understand is that they need and require optimum dental care. Oral complications as gingival hypertrophy and enlargement does occur, as well as the mouth ulcers, salivary gland enlargement, gingival bleeding, xerostomia, glossitis, and abnormal taste develop. Take a look at these pictures, and these are actual images of the medications that promote oral manifestations. Lots of oral complications and infections develop: mouth odors, herpes simplex, lymphadenopathy, lichen planus, petechiae, hemorrhaging, anemia, excessive bleeding. Take a look from these pictures. These are situations that are uncontrollable and are very common with organ transplants from the medications that they take. Let's take a moment to view this video on bone marrow transplants.
There are 4 major parts to a bone: the periosteum, a soft outer protective layer, then the cortical or hard bone that provides structural protection, cancellous spongy layer that protects the innermost layer, the bone marrow. The bone marrow is a thick jelly-like substance that is found in large bones and is responsible for the creation of blood cells. There are 2 types of bone marrow, red and yellow. Red bone marrow produces mesenchymal stem cells that can become blood, tissue, and/or bone cells. Red bone marrow is what is used in bone marrow transplant and is found in the larger bones of the body, which are the pelvis, sternum, vertebrae, clavicle, and skull. Yellow bone marrow, on the other hand, surrounds the red bone marrow and stores lipids. Mesenchymal stem cells are just a branch of a slew of stem cells in the body. There are 3 main types of stem cells: totipotent, pluripotent, and multipotent. Totipotent stem cells have total potential to become any cell derived from the zygote, or when an egg and sperm join. Pluripotent stem cells do this also, and embryonic cells, found in embryos, stillborn children, and umbilical cords, are categorized under this also. Multipotent stem cells are mature cells and are limited to certain tasks. Through cellular differentiation, the process of making a multipotent stem cell into a specialized one, the adult multipotent stem cells produce 3 main types of blood cells in the bone marrow: red, white, and platelet blood cells. Blood cells are imperative to the overall functioning of the body. The lack of or malfunctioning of any category of blood cells will ultimately lead to increased extremities regarding disease. Red blood cells mainly circulate oxygen, and the lack of these causes malfunctions such as anemia and extreme weakness. White blood cells fight infection and create immunities towards other diseases. Without white blood cells, the body is more prone to infection and extremified symptoms of sickness follow. Platelets are healer cells that stop bleeding by creating blood clots in the body, and the lack of platelets will result in excessive bleeding or hemophilia. You may ask yourself, why bone marrow transplant? Unhealthy bone marrow will lead to the lack of or malfunctioning of blood cells in the body. Bone marrow transplant is a surgical procedure that replaces unhealthy, dysfunctioning, and/or destructive marrow with healthy marrow. It also helps cure diseases caused by bad bone marrow, such as, but not limiting to, leukemia and sickle cell anemia. It can also be used to aid the body in its recuperation after high dosages of chemotherapy and radiation. In addition, this procedure can also serve to prevent further damages from genetic disease processes, treat lymphomas, certain solid tumors, immunodeficiencies, as well as kidney cancers. Bone marrow transplant follows one general procedure, which requires donation through harvest followed by filtration and insertion. The general process is standard, with the harvesting of the bone marrow from the donor using a syringe with a needle going straight into the red bone marrow area of the donor's long bone, which is most commonly done on the pelvis or sternum, and a quart or more of bone marrow is extracted. The donated bone marrow is then processed in a lab using an instrument to separate layers by density: plasma, the liquid that suspends and allows red blood cells to be transported, peripheral blood mononuclear cells such as lymphocytes and monocytes, and the red bone marrow itself. Prior to transplant, the patient's bone marrow undergoes targeted weak amounts of chemotherapy and radiation to irradiate it and cleanly replace the bone marrow without contamination of the original. There are multiple types of donation forms depending on the patient's state of bone marrow and disease. In some cases, it is possible to use marrow from the same body. This self-donation of bone marrow is called autologous bone marrow transplant. It is only possible if the patient has healthy bone marrow in other parts of the body that has not been affected by their disease, weak immune system, and/or health overall. If this is not the case, there are other forms as well. Syngeneic donation, which is from a patient's identical twin, if they had said twin. Another means of donation of bone marrow stem cells would be through the collection of embryonic stem cells from an infant's umbilical cord or a mother's placenta. This is called cord blood engraftment. Stem cells are frozen before they need to be used. This option is extremely efficient and poses little to no risk of transplantee host rejection, with a small risk of transplanting a genetic disease. But the controversy of using umbilical cords through harvesting cells derived from the embryo makes it extremely difficult to make possible. As both of these cases are quite rare, a more common means of bone marrow donation would be from a donor who shares the same genes as the transplantee, such as a sibling, parent, relative, or anyone else with a genetic matchup of at least 50%, also called an allogeneic donation. For example, as approximately half of one's DNA is derived from either parent, parents are ideal donors if no other relative has closer genes to match. Matches are determined through blood tests. Genetic matching is determined at the HLA or human leukocyte antigens genes level. Antigens are in toxins or any foreign substance that induces an immune response in the body, such as the production of antibodies. Human leukocyte antigens are proteins located on the surface of white blood cells and other tissues in the body, and the genetic matchup of the donor and transplantee depends on the body's major histocompatibility complex. MHC, which is a family of genes that dictates the creation of certain glycoproteins which are important to immune response. In each chromosome, there are a set of alleles called MHC haplotypes. In regards to humans, each allele for MHC is numbered. As all humans are heterozygous, each individual will have 2 MHC haplotypes, one from each parent for each chromosome. Each protein combination is different in each individual human, making every individual unique in their genetic makeup. For this reason, MHC molecules are polymorphic, which is when 2 genetic materials are present in one chromosomal population. MHC molecules receive antigens from inside the cells they are part of and projected on the exterior surface of their cell to be recognized by T cells to create immunities. Polymorphism varies at such a great extent that no 2 individuals are alike. This poses the case of matching HLA made up of MHC with donors and the transplantee, and tests are done to verify. It is extremely imperative that the donor and patient cells have a minimum of 50% matchup to avoid graft versus host disease, where the patient's cells attack the foreign ones, which would be the donation in this case, and this is fatal. With this said, allogeneic donations are still extremely rare if they are unrelated. And of those, only 5 out of 10,000 international unrelated donors are matched, and of those unrelated donors, only 1 in 25 of the patients matched have a chance at actually going through with the transplant. Once the bone marrow transplant is finished, post-bone marrow transplant symptoms vary as the body's immune system fights to accept the body's new foreign cells introduced from the procedure. These symptoms persist until the patient's body heals itself and accepts the transplant, taking anywhere from a few days to multiple weeks. Although the post-procedure symptoms are not permanent, side effects of the procedure are conversely serious. These include kidney malfunction, susceptibility to infection, and excessive bleeding. To reduce the likelihood of these, many blood transfusions and sterile environments are suggested. In addition, graft versus host disease also poses a threat and is extremely...
All right, this concludes Module 4 lectures on cancer and organ transplants. Please write a 200-word summary of what you have learned or what has maybe been the most important or eye-opening information that was presented in today's lecture, and upload it to the assignment Dropbox. There is a link that's been provided for you under Module 4.